Hi, I'm Beth Perry. It's Friday, August 1st, 2008. In this week's Beaker Beat, Roche's offer to buy Genentech has some shareholders in front of a judge. Promising drug news and disappointing drug news coming from the National Alzheimer's Conference in Chicago. Find out what appears to be working. And GlaxoSmithKline tunes in to the social media revelation. Those are some of the top stories in this week's Beaker Beat. So much for the dog days of summer. The last 2 weeks have been anything but. The life sciences community has been buzzing about the lowball offer for Genentech by Swiss healthcare company and majority shareholder Roche. Today, some Genentech shareholders were stepping in to protect their interest in the San Francisco biotech company, claiming an affiliation agreement between the two companies would block Genentech from getting the best buyout price for minority shareholders. If you're waiting with bated breath for the conclusion, it may be a while, but here's how we think it might play out. If you read the roadmap for how Roche drove their acquisition of Ventana Medical Systems out of Tucson last year, you'd see it was bumpy, taking several months, 5 offers, and a 19% increase in their price before they parked at a $3.4 billion deal. The current offer from Roche for Genentech is $43.7 billion, and while they don't seem to be able to agree on a price, industry spectators do agree it will likely be negotiated by the end of the year. More M&A activity. There's another potential acquisition that has people talking. Bristol Myers Squibb is offering $4.5 billion in cash for its cancer drug partner ImClone. ImClone's board has yet to comment on the offer. Bristol Myers already owns about 17% of ImClone and their cancer drug Erbitux. GE Healthcare hopes to give their medical products a jolt by buying Vital Signs Incorporated. That deal is valued at $860 million. And one of the world's top vaccine producers just got a shot in the arm. Sanofi Aventis agreed to buy vaccine maker Acambis for $548 million. Acambis and Sanofi have partnered on several projects in the past, and according to a department head at Sanofi, the acquisition was a logical step. And from the funding files, CVRx has recently raised $84 million in venture capital funding. The new money will put them in the home stretch of selling the first implantable device that treats high blood pressure. That product is currently in phase 3 of clinical trials. The International Conference on Alzheimer's Disease was held in Chicago this week, with more than 5,000 researchers sharing groundbreaking information and resources on the cause, diagnosis, treatment, and prevention of Alzheimer's. And lots of big announcements were made there. Hot topics included amyloid plaque, neurofibrillary tangles, and drugs. We first told you about it last month, and at the conference, the official announcement came. Myriad Genetics waved the white flag on their experimental Alzheimer's drug Florazan, which targeted amyloid plaque in the brain. And the failure left some of us wondering if amyloid plaque is the culprit in the onset of Alzheimer's. Now there's Elon and Wyeth and Eli Lilly as 2 of the leading candidates for Alzheimer's drugs currently in development. Elon and Wyeth also presented data at the Chicago Convention, which showed mixed results in mid-stage tests for their drug targeting amyloid plaque. The reviews are not stopping them. However, the results are certainly disappointing for one of the most highly anticipated drug candidates in the industry. But there's still hope on the horizon. Another company offered positive results by targeting a completely different brain lesion characteristic of Alzheimer's. The best news on the drug front came from a Singapore company who focused on neurofibrillary tangles instead of amyloid plaque. TauRx Therapeutics announced for the first time an experimental drug shows promise for stopping the progression of Alzheimer's by breaking up those protein tangles. They still have some time to go. We'll keep an eye on it, and we'll let you know how they're doing. Make no bones about it, Amgen's new osteoporosis drug has their stock at its highest in 14 months. This is after mediocre financial results earlier this month. Shares of the biotech giant have soared to their highest level in more than a year after reporting their osteoporosis treatment showed positive trial results, significantly reducing spine and hip fractures. The drug could be approved for postmenopausal osteoporosis in 2009 and could rack up sales of at least $1 billion in 2010, according to some financial analysts. Word on the street is there's a great probability that Amgen will seek a partner as they get closer, so stay tuned. And speaking of tuning in, GlaxoSmithKline has recently joined the YouTube generation. They're the second pharma company to slide into the ranks of Web 2.0 just weeks after Johnson & Johnson tuned in. But unlike J&J's channel, which features older videos and a weekly health-related topic, GSK seems to be using the site as a means for recruitment. One of the lead videos is of Andrew Whitty, GSK's CEO, talking about his growth in the company and what makes working there great. It's mostly an informational site with videos and the ability to view other subscribers' profiles. To note, they have turned off the ability to comment on videos, but that's not unlike their corporate counterparts on YouTube. Overall, a good step into the social media arena. That's going to do it for this week. We'll see you next Friday. I'm Beth Perry with Beaker Beat.